October is Breast Cancer Awareness Month, and while cosmetics and personal care products are made up of a number of ingredients, there are chemicals that are being studied for links to breast cancer. And this morning, McLean Dermatology and Skincare Center owner and Derm to Door CEO Dr. Lilly joins us to talk about breast cancer awareness and the skincare ingredients you really need to avoid. Good morning, Dr. Lilly. It's always great to see you.
Good morning, Holly. How are you?
I am doing well. And you know, I read a lot of the literature that you sent over, and one of the statistics that stood out the most to me was the one that said only 20% of breast cancer patients is due to genetics. And so that means there are other factors out there, environmental factors out there that are causing women and men to get breast cancer. And so talk to me about these ingredients that we need to be leery of.
Sure. There's a huge environmental factor when it revolves on any cancer, not just breast cancer. Our environment, the chemicals in our environment, where we live, things in the air, things we put on our bodies. And so breast cancer is just one of them. And because it's Breast Cancer Awareness Month, we want to bring this to light that one product may not be a link to breast cancer, but the accumulation of these over a lifetime have shown to actually develop and actually accumulate in tissues, including breast tissues. So we just want everybody to be aware, if you have a family history of breast cancer, if you have a genetic mutation in your family that you know may be linked to certain cancers, particularly breast cancer, you should just be aware of what's in your environment and what you're putting on your skin.
And when you're talking about these ingredients, like you say, we can't say directly this causes cancer, but we do know that like this disrupts the hormones, and then that is what can cause the mutation that leads to breast cancer. Let's talk specifically about products, because I know some people out there are going, how is it that something I'm going to put on my skin is actually going to be inside me and cause a problem?
Yes, it's just accumulation over years and years. I mean, people don't realize how many chemicals are in our environment every year, from the shampoo, the conditioner, the moisturizers, the serums, the deodorants we use, the things that you clean your counters with. All of these are chemicals, and the accumulation over time, and it's not just any time, it's through the lifespan, particularly at a younger age when the body's developing and there's certain hormonal fluctuations and changes in our body. Those can be a very important time for development of these chemicals in our body. So we have to be aware of what's around us and make sure that we use things in moderation. It doesn't mean you have to eliminate everything, but you have to really understand labels and read your labels to make sure that you're avoiding certain things that could be an instigator. Okay. These chemicals are called endocrine disruptors. An endocrine disruptor is either it acts like a hormone or it changes the balance of other hormones. And things like parabens and phthalates that are in a lot of our moisturizers, cosmetics, our chemicals that we put on our skin and our hair, those are endocrine disruptors. And what they can do is they can act like an estrogen. And we know that breast cancer can be estrogen sensitive. And the accumulation of those can mock an estrogen in those tissues.
So when we see parabens and phthalates, when we see those two words specifically, like on the label, probably put that back on the shelf. Do they come, are they disguised as other names sometimes?
There's a lot of names, and that's why understanding what names like methylparaben, ethylparaben, propylparaben, those are all parabens. And there's a lot of abbreviations for terms, like phthalates are DPP, DEP, those are all those very kind of disguised terminology. So what we want to say is make yourself aware of these terms, educate yourself, look at the labels, make sure that you understand what's in the products that you're putting on your body.
The other thing that I read that kind of stood out to me was they said be leery of anything that says it has a fragrance or a parfum in it. Is that true?
I'm not sure if that's necessarily true for breast cancer, but, fragrances and things that are called disguising fragrances, or they disguise, chemical scents, those can cause allergies and reactions on the skin, but not necessarily breast cancer.
What are the products that are out there that are usually the worst, where you find it the most? Is it nail polish? Is it, moisturizer, shampoo?
Skin products, these are all preservatives, and that's what makes something have a shelf life, the parabens. It gives it that 1-year shelf life because it makes sure that the materials don't break down. So those are all really important things to kind of look for. And hair products, nail polish, hairsprays, things that we, disinfect with, those are all very common ones to look for.
All right, Dr. Lilly, we always appreciate your insight and knowledge. Thank you so much.
Thank you for having me.
There's her information there if you want to find out more, but super informative.
Yeah, jam-packed with the important information. Holly, thank you.